Hello and thanks for joining us on Chicago Tonight. I'm Nick Blumberg. Brandis Friedman has the evening off. Here's what we're looking at. Local advocates are pushing back against the Trump administration's rule change blocking undocumented children from some early education services. The decades-old Chicago tradition of aldermanic prerogative is put to the test at City Hall. And lessons learned from the city's deadly 1995 heat wave that killed hundreds of people. First off tonight, undocumented children may soon be unable to access the federally funded preschool program known as Head Start. The Trump administration is looking to block them from the program as part of its ongoing efforts to limit access to federal benefits for immigrants without legal status. Officials say the change is a way to, quote, protect benefits for Americans, but advocates warn the shift could have dire effects that go beyond the undocumented community. Joining us now with more is Lori Morrison-Frichtel, Executive Director of the Illinois Head Start Association. Thank you very much for joining us.
Thank you for having us.
So the Trump administration's move goes against a legal interpretation that dates back some 30 years, as well as a Supreme Court ruling that's more than 40 years old. Tell us about sort of the basis for including undocumented children till now in Head Start.
Yes, so Head Start's mission has always been to serve those most in need across our communities, and we've never asked about status of the individual family or child. And this new law, effective yesterday, tells us that we have now to ask about documentation status of our children and families based on them, the Trump administration, moving Head Start to a federal public benefit. We'd always been considered an educational program, and they moved Head Start to that federal public benefit category.
So when the rule change was announced here, Health and Human Services Secretary Robert F. Kennedy said in a statement, quote, "For too long, the government has diverted hardworking Americans' tax dollars to incentivize illegal immigration. Today's action changes that. It restores integrity to federal social programs, enforces the rule of law, and protects vital resources for the American people." What was your reaction to that announcement?
It's the impact that it's going to have across our communities for children and families. Our families are using Head Start for educational purposes and also to get to work. They're working families, and if they don't have access to Head Start and early Head Start, they can't get to work, and it has a big impact across the communities throughout Chicagoland.
And what are you hearing from families and providers about this move?
Yeah, so this is the first interview I've done solo. Usually I have a sidekick, and I couldn't find anyone to join me today because they're fearful of what this new ruling and the repercussions that might happen if they were seen here for their children and families involved in their program. So this new rule, whether you're documented or undocumented, has created a lot of anxiety and fear across our community.
And I would imagine for folks offering Head Start, there's some confusion as well because they don't necessarily know the mechanics of how this will work.
Right, there's no guidance on what is considered. We hear that nonprofits will be exempt from this rule. But we're not 100% sure. There's some legal analysis that there might be wiggle room for the administration to make it mandatory for all Head Start programs to check status of families. Even though the nonprofit is in the law, they strongly encourage programs to follow the law.
Well, yeah,
so that alone creates confusion and chaos within the system. There's no guidance that was issued, whether it's the status of the child or the family. So we are encouraging our programs to hold and wait for guidance from the Office of Head Start.
But it does seem, as you mentioned, there are sort of nonprofits, community groups, as well as school systems that offer this. It would seem that this rule certainly bars public school systems from offering this.
Right. So we're worried about our school districts that are offering Head Start and early Head Start services, our city government grantees that are offering Head Start, early Head Start services, and higher education institutions that are offering Head Start and early Head Start services.
And if there is some sort of wiggle room there with say, nonprofits, Could that create a further strain on those providers if, parents have to move their children away from, say, a school district?
Absolutely. So we're worried that it will create, documentation. You peel back the onion here, you have fear within the community, you have staff that are worried about documentation, which we've never asked before. Where do we store that personalized information? There's all kinds of pieces here, and the demand may be greater within our nonprofits if the school districts have to check status and families are worried about sending their children there. But it'll have a chilling effect across the whole community, regardless of whether you're a nonprofit or a school district or a city government.
And, for families whose children are still eligible, do we know yet how exactly they'll need to prove that eligibility?
Yeah, that's the big question, and we don't have any guidance on that around verification and how we will document that status and how that will be used in the future against the program or against the family.
And, you mentioned both sort of Head Start, early Head Start. Remind us, for folks who maybe don't remember kind of the range of programs that are offered here, what all Head Start entails.
Yes, so our mission is to serve those most in need. Early Head Start is prenatal up to age 3, and Head Start is preschool, age 3, 4, and 5-year-olds. And we're a 2-generational program. We serve both the child and the family together that creates huge impact.
And, the White House had previously called for eliminating Head Start funding altogether in the 2026 budget. Are you concerned this entire program could still be at risk in future budgets?
Yes, of course, always. And our Congress is currently working on appropriations. Even though there was a promise they would flat fund Head Start, we're still very active and involved in the FY26 appropriations. And we still have funding that doesn't come through. The federal payment management system was down last week. Programs had a hard time accessing funds to pay their workforce. So there's still a lot here that creates, that chaotic kind of craziness when you can't draw down funds and pay your staff. And then now this new rule around immigration status.
And even that flat funding, would that necessarily cover demand or increase costs?
That's truly a cut within our program.
Your organization is already part of a lawsuit related to Head Start. Tell us about that legal action.
Yes, so thank gosh, we joined ACLU in April, issued the legal action to protect Head Start, our funding. We lost our regional office. They closed 50% of the federal regional offices across the country, and now this immigration status. They're amending the lawsuit today, and then we're asking for a temporary restraining order against this new policy around immigration status.
And are you hopeful that sort of action can kind of preserve the status quo of the program as it is now?
Yes, it would protect our Head Start programs and early Head Start programs across the state.
All right, well, I know there's going to be a lot on your plate in the coming weeks and months, and this is something we'll keep keeping an eye on, but that's all the time we have for now. Lori Morrison-Frictel, thank you very much.
Thank you. We appreciate it.
Up next, an effort to help address the affordable housing shortage in Chicago.
Chicago Tonight is made possible in part by the Alexandra and John Nichols family, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
A proposal designed to chip away at Chicago's massive affordable housing shortfall passes a key city council committee today. The plan would allow property owners to build tiny homes across the city, but its fate is uncertain because it would weaken Chicago's decades-old tradition known as aldermanic prerogative. Our Heather Sharon joins us now with more. So Heather, in most of the city, coach houses, granny flats, things like that, they've been banned since 1957. Why is City Council now on the verge of reversing that ban?
Well, if you've looked for a new apartment or a new house, you know Chicago is in the midst of a housing crisis, short nearly 120,000 affordable units. Now, Mayor Brandon Johnson was elected on promises to chip away at that shortfall, and he believes granny flats, attic units, basement units is one way to do that. So back in 2021, a pilot program was launched to see how this would work. City officials say it's been a rousing success, but it has taken nearly 2 years of negotiations to get to this point where the City Council is set to take a final vote on it tomorrow.
So where did we land? How exactly would the new ordinance work?
Well, it builds in some protections for areas of the city that are more suburban-like. So if you live on a block that is zoned for just single-family houses, this ordinance would prevent more than 3 new units from being built into the existing homes. Also, it would require owners to live on the property in these sort of single-family neighborhoods. However, if the alderperson thinks that more units should be built on a given block, they can lift those restrictions.
Okay, well, some of the changes, some of the things we landed on, they weren't enough for some alder people. They were blasting the plan. What are their concerns?
Well, they say that this would weaken aldermanic prerogative, which is the decades-old tradition of each alderperson getting to decide what gets built in their ward and where, because this would allow tiny houses to be built without special permission citywide, and they say that could destroy the fabric of the so-called bungalow belt, and it will in fact sort of set a precedent of maybe we don't always have to look to the local alderman for citywide issues like this.
There's an idea I've heard floated before. Now, there was another fight that got sidestepped, another fight over aldermanic prerogative today. This was about a Lincoln Park apartment complex. The committee actually voted months ago, wasn't it, to reject this proposal? Why is that?
Well, it was resurrected thanks to an obscure part of the city code implemented by former Mayor Lori Lightfoot to tackle the shortage of affordable housing. Essentially, Sterling Bay, one of the city's largest developers, refused to take no for an answer and signaled that it would use this law to force the City Council to reconsider the zoning committee's vote, and it did so. And Alderman Scott Wagsback, who had spent months in opposition to this project, dropped his opposition today.
How did they get him on board?
Well, they reduced the number of units by 25 units. That means one of the 2 towers will be slightly shorter, but the big change was the reduction in the number of parking spots. That will go down nearly 60%, which the alderman asked for because he said, hey, look, this is a location that is served by buses and trains, and there is no reason to put more cars in this incredibly gridlocked part of Chicago. That was enough, but perhaps in the back of his head, he realized that there were enough older people who wanted to see some of the first affordable houses built in Lincoln Park to sort of take the deal that was on the table.
Could be little column A, little column B.
That's how it works at City Hall.
Heather Sharon, thank you very much.
Thanks, Nick.
And you can read Heather's full story on our website. That's WTTW.com/news. We're back with more right after this. 30 years ago, on July 12th, a heat wave settled over northeastern Illinois. A day later, the heat index peaked at 124 degrees, and soon area hospitals were overflowing with people suffering heat-related illnesses. By the time the heat relented days later, 739 people had died, and the city was using refrigerated trucks as makeshift morgues. The victims were disproportionately elderly and people of color. Joining us now with more are Dr. Howard Ehrman, who was working at Cook County Hospital 30 years ago when the heat wave deaths began. Ehrman is a former assistant health commissioner for the city of Chicago, former UIC professor, and is a co-founder of the People's Response Network. And Lynette Sims, chair of the People's Response Network, which advocates for racial and social justice and expanding the city's health network and other social services. We should mention this afternoon we invited a representative of the Chicago Department of Public Health to join us as well, but no one was immediately available. But we thank you both for joining us. Welcome to Chicago Tonight.
Thank you.
So, Dr. Ehrman, as we mentioned, you were working at County when the heat wave struck. How long did it take you and your colleagues to realize just how dangerous things were getting for many Chicagoans?
It happened on the first day. We could see that people were being transported in increasing numbers as the day went on. They were sicker and sicker. Many people passed away in the ambulances, both Chicago Fire Department ambulances and private ambulances. And their core body temperatures were beyond belief in terms of our experience. That means that they had temperatures above 105, 108 degrees. So it didn't take long at all.
And what were the factors that made the heat wave so dangerous?
Well, it was a combination of, in quotes, a natural heat dome with the fact that Chicago has massive heat islands that are primarily concentrated in black and brown neighborhoods on the south, southwest, and west sides. And those heat islands have been getting worse since 1995. And the fact that the city had massively cut back the health department and social services while increasing the budget of police.
Yeah, we'll dig in on all of that. I should mention we're seeing some footage from that time from the Cartemquin documentary Cooked. Lynette Sims, you've looked into that, really dug in on how the heat wave hit largely black and brown communities on the west and the south sides. We've got a map that you provided. What did you find when you looked into that?
So the map that we provided, the first map is from the heat death rate map, and it showed that majority of the heat fatalities were from the south and west side. We also participated in the 2023 Chicago Urban Heat Island Mapping Project, referred to as Cool Shy, and it found that it's a 22-degree difference in the afternoon period between community areas. 22
degrees. I mean, one of the things that I thought was so interesting that folks might not think about, communities of color are less likely to have significant coverage from tree canopy. What kind of an effect can that have?
So yes, due to the south and west side being impacted by redlining, redline communities are less likely to have tree canopy. They are also closer to the expressways like the Dan Ryan and the 290. And in addition, they are less likely to be able to afford utility bills. And because of 1995, they didn't turn on the air conditioning due to the bills, and that same problem is happening today.
Yeah, even if they had AC, they may not have been able to afford it or afford to run it enough at the time.
Yes.
Dr. Ehrman, as we mentioned, you were sort of assistant health commissioner. You left in the early 90s. Was the city government adequately prepared for the heat wave in 95? Were folks getting adequate warnings?
No, not at all. So before 95, the fire department and the health department were primarily responsible for emergency response. The OEMC, the Office of Emergency Management and Communication, happened after the heat wave. We had talked about heat waves, we had talked about cold waves, but the problem was that once Mayor Richard M. Daley took office in 1989, he began the biggest, most massive privatization program and cutbacks in public services, including the Department of Health. So we went from 2,000 employees to less than about 1,400 when the heat wave hit. So no, the city was not prepared at all.
And folks may or may not have been prepared for to how to handle this, how to mitigate it, or knew that it was coming. Is that fair to say?
Well, I think the problem is that people didn't have air conditioning. A lot more people did not have air conditioning in 95. More people do have maybe a window unit now, but as Lynette said that basically the cost of electricity through ComEd has gone up almost 4 times, so it's likely the people would turn it on. People were not going door to door because of the cutbacks in public workers. So the first responders were primarily police, and often they got there too late, and often basically people did not go out because they were afraid for different reasons. So the social networks that existed in all our communities had begun to break down, and therefore the public response was completely inadequate.
Well, and how about those social networks, today, Lynette Sims? How have, sort of changing population patterns potentially making extreme heat more dangerous for some residents, more dangerous for seniors?
Absolutely. So in 1995, the seniors who passed away were isolated, and also the city of Chicago's Black population was significantly bigger then than it is now. A lot of Black Chicagoans moved back to the South due to various issues and regarding public safety issues, also jobs, access opportunities. So our seniors now have less of those social networks due to, for lack of a better term, a reverse migration back to the South.
Yeah, I mean, what sort of, I would imagine that can create potential dangers or negative outcomes, not just for things like heat waves, but just having that sort of social isolation, not having people to look out after them.
Yes, so, just like mental health, like for the seniors, losing those social connections, losing the sense of community. And during the pandemic, it kind of forced us to become more isolated and focus on screens, have meetings via Zoom virtually to have like some sense of community, but it's not the same as the networks that we had prior to the pandemic and those connections.
Yeah. Well, Dr. Ehrman, how would you rate sort of the city's preparedness now? I mean, there were things like the cooling ordinance that went into effect in 2022, or have there been some positive steps?
I would say literally the cooling ordinance is the only positive step in 30 years. The fact of the matter is that the city thinks it's doing better messaging, but it took 2.5 days until 10:37 this morning for the Office of Emergency Management and Communication, which is in charge of emergency response, to put an air alert that the National Weather Service put out Saturday night. So that's not good that it takes 2.5 days when we've spent over $4 billion in the last 30 years on the Office of Emergency Management and Communication. Now, the cooling ordinance, which we're very happy that 49th Ward Alderwoman Maria Haddon worked on, we also collaborated with her to actually make it better. The problem is that no one knows if that ordinance is really in effect. It called for May 1st of 2025 that every senior building, whether that be in other high rises that are both CHA, Section 8 and other ones, would have to have air-conditioned community centers inside the buildings. When we've asked the Commissioner Hopkins and we've asked Maria Haddon if that's true, no one can tell us. It's the same thing that FEMA has done, which is inadequate in the city. It's all on the individual. If you're too hot and you're 82 years old in one of these buildings, then you have to call 311 and hope that a building inspector comes within the next few hours before you die from the heat wave. That's exactly what's set up now. That's completely wrong. It should be that city workers and or people from those buildings who are able to go door to door should find out if it's too hot. There's instruments that cost $20 to $30 people can hold in their hands that'll tell everyone what the temperature humidity index is, and then be able to move people who are really at risk into those community rooms. But those community rooms aren't large enough for all the residents. So I think it was a step forward, but no one knows if it's actually being implemented.
Well, one of the things you often hear during particularly hot times as well is that the city's got all sorts of cooling centers, but Lynette Sims, do people have enough access to those cooling centers?
No, people don't have enough access. Also, there are transportation barriers, depending on like what part of the city if you're from. If you're from the Argyle Gardens area, trying to come to 10 South Kelsey is a bit of a barrier in itself. In addition, residents don't feel comfortable at the cooling centers due to, it was a Chicago Reader article during the wintertime, people got kicked out for falling asleep at one of the cooling centers. So they're not very friendly. They're not advertised enough. And also the cooling centers are not 24 hours. Most of the cooling centers, the city-run ones, are from 9 to 5.
Well, certainly much more for the city and lots of folks like yourselves to do to prepare, especially as extreme heat becomes more common. But we thank you both for looking back and offering some advice. Dr. Howard Ehrman and Lynette Sims, thank you for joining us.
Thank you for having us.
Thank you.
And that's our show for this Tuesday night. You can stream Chicago Tonight on our WTTW YouTube channel every evening and catch up on any programs you may have missed. Join us tomorrow night at 5:30 and 10. Now, for all of us here at Chicago Tonight, I'm Nick Blumberg. Thank you for watching, stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that serves the needs of clients in the Chicago area and throughout the nation.